From the entire OCO team, thank you for choosing us to help you see your best with cataract surgery. The main purpose of this video is to give you all the important information to ensure that you have the best surgical experience, particularly on the day of your surgery. And we also want to cover some key steps that we would really recommend that you follow before your surgery in order that your day goes as smoothly as possible. Step number one, on the evening of your surgery, place a single drop of Alevro into the eye that's going to be undergoing surgery the next day. It's really important to understand the best way to place eye drops into the eye, so let's go through instilling eye drops now. You just need to instill one drop of each medication. Is more than one drop any better than putting just one drop in? No, the tear film can only handle one drop at a time. If you need to put several different drops into the eye, we would want you to wait for 1 minute minimum between placing the next drop into your eye. If you use other regular eye drops, you should clarify with your doctor whether you should put these drops in immediately before or after your surgery. We'll provide you with a detailed written schedule of your eye drops, so you'll have all the information and instructions you need to clarify this. Probably you'll need to take eye drops for 6 or 7 weeks following your surgery in most cases. And the most challenging thing about going through cataract surgery, most people would say, is actually having to put the eye drops in for that length of time. 1 or 2 days prior to surgery, our day surgery team will make contact with you and they'll give you your admission time and instructions about eating and drinking before your surgery. On the day of your surgery, double check your admission time, follow your eating and drinking instructions. You can eat up to 6 hours before your surgery time. There are no special restrictions on what you can eat, but you should not eat within 6 hours of your surgery, and you should not drink anything other than water within 6 hours of your surgery. You can drink water up to 4 hours before your surgery, but nothing by mouth after this time. So usually if you're having surgery in the morning, you'll skip breakfast and the nurses will feed you immediately after your operation once you're in recovery. If you're having surgery in the afternoon, you'll be able to have an early breakfast, though nothing for morning tea or lunch. You'll have an eye drop to dilate your pupil. We want you to place this eye drop in your eye before you leave home. This drop typically stings when it goes into the eye, and the purpose of this drop is to dilate your pupil in preparation for the surgery. You can dress in normal clothes, but because the actual theater room is relatively cold, we ask that you dress warmly, dress in layers. Please wear pants, wear socks, do not wear shorts or sandals, and dress warmly. That will make your experience much more comfortable because you won't get cold. We want you to stay warm, even if it's hot in Brisbane in the summer. It's cold inside our surgical center, so dress appropriately. If you want to come in short sleeve shirts or pants, bring socks, bring layers that you can put on, and bring a jacket so you can put it on to make sure you stay warm during the 2 or 3 hours that you'll be at the day surgery center. It's okay if you bring personal items or your phone. However, we discourage you from bringing anything of great value. We also have a small secure locker area for your personal items when you're in the actual procedure itself. Once you schedule your surgery, our team is set in motion with a tremendous amount of work to prepare your operation. We might have to order lens implants, special surgical supplies, special medications, and we reserve that time on the date for you. Our surgery schedule is very busy and the time we have is precious. So if you need to cancel because life just happens, please give us 72 hours notice in advance of canceling your operation or rescheduling it. If you wear a hearing aid on either side or on both sides, and you're having eye surgery too, for example, you should not wear the hearing aid on the side that you're having eye surgery. So if you're having eye surgery in your right eye, then please leave your hearing aid out on the right side. If you're having surgery on the left side, then leave the hearing aid out of the left ear. You can wear a hearing aid on the opposite side to the side you're having eye surgery on. And the reason for leaving the hearing aid out is that you put a lot of water around your eye to both prep your eye and during the surgery and at the end of the surgery. Some of this water or the eye drops we use at the end of the operation can run down the side of your face and potentially into the ear canal. And if you're wearing a hearing aid, it potentially could damage the hearing aid. So please refrain from wearing hearing aid on the side that you're having your eye surgery done on. A similar thing applies to contact lenses on the eye that's going to have surgery. For example, if you're having surgery on your right eye, do not wear a contact lens on your right eye on the day of surgery. You can wear your contact lenses right up to the day before your surgery, and you can continue to wear contact lenses in the opposite eye. That's perfectly fine. On the day of surgery, please bathe or take a shower as you normally would, and please make sure you wash your face and your eyelids and lashes very thoroughly. We want them to be as clean as possible. If you wear eye makeup or mascara, please clear any eye makeup or mascara away from your eyelids and eyelashes. We don't want any debris in your tear film related to eyelid or lash makeup. A lot of patients will have some crusting around the base of their lashes. That's something called blepharitis. It's very, very common. If this is something that you suffer from, then use some baby shampoo or something such as Sterilid to gently massage and clean and scrub away that debris on the day or the day before your surgery. Your doctor will discuss this with you. If you have any concerns about blepharitis, we want this to be under control before going ahead with surgery. On the actual day of the surgery, please don't wear any creams, moisturizers, or lotions anywhere on your face, particularly around your eye, because we're going to be applying a sterile drape around your eye, and we want that to be working properly. We want it to really adhere to the skin around the eye. That's important. And so any makeup items or lotions or creams would reduce the adhesiveness of the drape, and that's an important step. So refrain from eye makeup, lotions, and creams on the eyelid and the skin of the face around your eye on the day of surgery. Routine medications. A common question is, should I stop my medications prior to surgery, or should I stop any of my medications? The answer is no. You can take all of your normal medications at the normal times prior to your surgery. You should not have to stop any eye drops and any pills leading up to the surgery and continue to take them normally. People are often quite nervous before going through the surgery, and their blood pressure will be more susceptible to going up. So it's really important that you continue medication to control the blood pressure as much as possible. What about aspirin or blood thinners? Do you need to stop any of these before cataract surgery? And again, the answer is no. There's no bleeding risk related to cataract surgery, so continue to take these medications as you normally would. Stopping these medications could impact your general health, so continue as normal. If you take diabetes medications, we will give you specific instructions which will depend on the medications and the type of diabetes you have before your surgery, and your anaesthetist can clarify these with you as well. If you don't have a health fund, the day surgery will request payment for the procedure on the day of surgery. If you're using a credit card or a debit card, it's recommended that you contact your bank or credit card company before arriving at the day surgery center and inform them of the upcoming payment. And that way they'll know to expect that when the transaction goes through and it's a higher amount than usual, that it won't be flagged and blocked. Any out-of-pocket payments to the practice will need to be made before the day of your surgery. Our anaesthetists are independent practitioners, and they'll send you an invoice after your surgery has been completed. The sequence of events after you arrive is that you'll often need to complete admission paperwork with one of our day surgery admin staff. Following that, you'll see one of the admission nurses who will ensure that you've followed all the fasting instructions. They'll check that your general medical status is optimal for going ahead with the surgery and that your blood pressure is okay. Following this, you'll transfer to the pre-op area and meet the anaesthetist, who reviews your medical history and any specific issues related to your general health. The anaesthetist will explain the process of IV sedation. They'll place a small amount of local anesthetic, usually in the back of your hand, so you don't feel the IV going in. The anesthetic assistant will start prepping your eye with local anesthetic drops and a solution to sterilize the surface of your eye, usually povidone iodine or chlorhexidine, depending on the surgery, the surgeon, and your allergy status. In some cases, you may need to undergo some special markings on the surface of your eye in certain cases of astigmatism correction, and the anaesthetist will do this once your eye has been completely numb with the anesthetic drops. Once all of this prep has been completed, the anaesthetist gives you some IV sedation. Following this, you'll be very relaxed. Most people are very drowsy or they're unconscious, so they don't have any or much awareness of the procedure. Typically, most people are not able to recall going into the actual theater, and they're unaware at all of anything taking place during the procedure, and their first memory is usually sometime after they return to the recovery lounge. After the surgery, you'll have a clear plastic shield taped into position over your eye. You'll be able to see, but the vision is relatively blurry for the first 12 to 24 hours. The eye is usually quite comfortable, and some people will notice a mild scratchiness, the sensation of an eyelash in their eye that can be present during the first half an hour or few hours after the surgery. The nurses will give you some wraparound shades because your pupils will be dilated for about 24 hours or more, and this will mean that you're a bit more light sensitive than you ordinarily would be, and the shades can be used when you're outside for the first day or two. You can wear the shades when you're outside for the first 2 or 3 days, and then you can continue to wear them if you like, or you can continue to wear normal, regular sunglasses if that's your preference. How long will surgery take? Well, the surgery is usually very brief, about 20 minutes per eye. But in general, you'll be at our day surgery center for about 2 hours, and you won't be able to drive yourself home for 2 reasons. We'll give you IV sedation, which helps you relax during the surgery and makes you a bit sleepy and less responsive for up to about 24 hours after the surgery. And secondly, it takes time for your vision to recover sufficiently for you to return to normal driving. After surgery, one of our very lovely recovery nurses will go through all the post-op instructions with you and your carer, and will give you the post-op surgery pack. Generally, you'll start your first post-operative drops about 4 hours after surgery. We'll recommend that you go home and rest for the first 24 hours after the procedure. After surgery, you won't be seen perfectly immediately. You'll be somewhat blurry on the first day following surgery, and you'll need somebody else to drive you home. On behalf of the entire team, thank you for entrusting us with your upcoming surgery. We're going to be working extremely hard to make sure that you have the best possible experience and that you have the best possible outcome such that we can meet or exceed your expectations. We'll be working hard to make sure this happens. Thank you again. We have a great team and we're going to be taking great care of you. It's normal to be apprehensive about the surgery, but you'll find, like most people, that once you've been through it, it's been a very comfortable experience with a tremendous improvement in your vision. Thank you again. So if you're over the age of 45 and you've noticed your vision is deteriorating and you're becoming more reliant on glasses, particularly for reading and computer work, and you're wondering what you can do to free yourself from those glasses, it's likely you're a good candidate for lens replacement. So go online and book a free assessment today and see if that's a good option for you and to see if you're a good candidate for the procedure.